I hope you can all hear me, please. Okay.
Yes, please.
Yes, please.
Okay. All right, so I'll be starting. I am Vera Owusu, and today Edinam and I will be discussing maladaptive behaviors in children. So we'll move on to the outline of this discussion. So we'll be talking about what maladaptive behaviors are, the reasons and factors that contribute to maladaptive behavior in children, types of maladaptive behaviors, therapy options for maladaptive behaviors in children, when maladaptive behaviors warrant treatment, why they occur in children with autism spectrum disorder, that is ASD, and the functions of some behaviors in applied behavior analysis, that is ABA, and strategies for behavior interventions. So when we say maladaptive behaviors, when we are breaking down the maladaptive, mal, according to Wikipedia, means poor or inadequate. And maladaptive behaviors can be poor ways or inadequate ways or adapting to situations. Okay, so they are described as ways in which individuals conduct themselves that interfere with their daily activities or functioning in a particular environment or settings. And these behaviors usually prevent children from adjusting to difficult or demanding situations. They usually interfere with their learning, social life, or daily lives. And examples of maladaptive behaviors are aggression, self-harm, can be them banging their heads against the wall or trying to bite themselves, avoidance, trying to escape activities, can be academic works, and also withdrawal from others. When a child likes isolating him or herself and also prefers solitary play, that is an example of maladaptive behaviors. And they are often seen as a way in which these children cope with depression, stress, or anxiety. Okay, so we'll be looking at the reasons for maladaptive behaviors, please. Okay, so maladaptive behaviors can pop up at any age in children, but they usually peak during toddler age or adolescence. And some reasons for maladaptive behaviors include difficulties in communication. You see, children below in their toddler years are now learning how to communicate, and hence they have limited vocabularies. Hence they engage in maladaptive behaviors like throwing of tantrums to express what they want and how they feel. Learned behavior to children usually imitate the actions and words of those around them. So if the child goes to school and the child sees that, oh, this person did this, the person rolled over the floor, the person threw a tantrum, and the teacher hugged the person and gave the child candy, then definitely the child will also learn it and try it, because if this person did it and got a hug and a candy, then if I do the same thing, I also get a hug and a candy. And emotional dysregulation issues include describes when a person has difficulties regulating their emotions, and this include mood swings and mood fluctuations. Also, another reason for maladaptive behaviors in children is problematic thinking patterns. And this is when a person has negative thoughts or repetitive thoughts that distorts the person's perception of reality. An example is when a child feels like, if I am eating and a drop of the food falls on the ground, then my whole world has come to an end. If the child is eating and that happens, stress or anxiety starts to build up in the child, and the child starts to engage in maladaptive behaviors. Okay, so factors that contribute to maladaptive behaviors, we have three main factors for here. We have environmental factors, emotional and psychological factors, physical factors. With the environmental factors, family exposure to family conflict and inconsistent parenting styles usually may lead to a child struggling with aggression and defiance, because family dynamics and home environment have huge impact on children. So that's why the saying charity begins at home is there, because whatever happens at home affects the child's behavior. Also, peer relations are very, very influential on the lives of children. So a child struggling to make positive peer relations or struggling with bullying tend to put up maladaptive behaviors. And emotional and psychological factors, prolonged exposure to stress and trauma usually lets these children withdraw themselves, because a child who has a traumatizing experience with socializing will start withdrawing him or herself from social activities, or will not engage in social activities. Also, people experiencing stress or individuals with attention deficit hyperactive disorder, as ADHD, are usually overstimulated and have difficulties controlling their emotional reactions. And it contributes to maladaptive behaviors like withdrawal from people. And also physical factors like sensory processing issues, chronic pains, and neurological conditions like autism spectrum disorder, that is ASD, and sleep concerns also contribute in maladaptive behaviors, because if a child is going through a physical discomfort and the child is not feeling okay, they tend to put up some aggressiveness. Even as adults, when we are in serious pain, most of us tend to scream or curse. So these are all things, physical factors that leads to maladaptive behaviors. And the children with autism spectrum disorder usually have difficulties following instructions, paying attention, or sitting. And these usually interferes with the particular settings that they are in, and also it interferes with their daily activities. And inability, not being able to sleep, tends to make them a little moody. Even as adults, makes us moody. So, and also aggressive. Yeah. So we are moving on to the types of maladaptive behaviors, and we have 4 here. We have aggression and defiance, and children struggling with these usually feel powerless or unheard. Due to that, they put up behaviors like hitting others or hitting themselves, biting, yelling here. And impulsiveness and hyperactivity is also a type of maladaptive behaviors. Children who are experiencing impulsiveness and hyperactive are usually have difficulties sitting at one place for a while, paying attention, and struggling with following instructions too. Anxiety and withdrawal is also a type of maladaptive behavior. Children who are experiencing this prevent themselves from engaging or participating in activities, social activities, and they prefer to isolate themselves or prefer solitary play. And the sexual maladaptive behavior is usually common in older children or those who are approaching their adolescent stages. And this is usually due to poor boundaries at home. When that happens, these children tend to be exposed to premature puberty, and it usually affects themselves and those around them. Okay, so we'll be looking at some therapy options for maladaptive behaviors, and we will start with ABA therapy. That is the common one that we do at Mission. So with the ABA therapy, it helps individuals, especially children, helps individuals identify the maladaptive behaviors and find alternative ways in which they can, alternative behaviors that they can put up alternative behaviors that they can put up. And cognitive behavior therapy too does the same thing. It also recognizes the poor behavior that the individual is engaging in and also find alternatives for them. The interpersonal psychotherapy focuses on relationship issues and how maladaptive behaviors put a strain on our relationship with others and others. And lastly, the addiction therapy is usually for people who are addicted to food, sex, or drugs. Okay, so Hartley and two other people, that is Sequoia and McCoy in 2008, did the research about the prevalence and risk of maladaptive behaviors in young children with autistic disorder. And the results of their research showed that 1/3 of children with ASD had high scores in withdrawal, attention, and aggression. And they used the CBCL scale, that is the child behavior checklist syndrome. So their research concluded that there is a need for behavioral management strategies for young children on the autism spectrum disorder as a way to increase their social engagement, sustain their attention, and also decrease aggressive behavior in the children. Okay, so in applied behavior analysis, we manage maladaptive behaviors by identifying the behavioral deficits and behavioral excesses of these children. Behavioral deficits are usually the behavior that these children exhibit when they have not developed or learned some skills. These skills include language and communication skills, social skills, play skills, personal care skills, and motor skills, both fine and gross motor skills. So in ABA, we engage these children in activities that help them learn these skills and as a way to increase the occurrence of these behaviors, the use of these behaviors. And in the behavioral excesses, these are behaviors that occur more than they should in these children. And these behaviors include aggression, tantrum, self-harm, can be biting themselves or hitting their heads, repetitive behaviors like hand flapping, tiptoeing, and so compulsions and inflexibility. Well, ABA engage children in these behaviors that helps reduce the excesses and as a way to tone down the maladaptive behaviors that they are putting up. Okay, so the following behaviors show when treatment is warranted for a child. When the behavior poses a risk of physical harm to the child or others, when a child engages in a behavior that's like biting him or herself, hitting him or herself his head or her head against the wall, it's a behavior that warrants treatment because the child is trying to harm himself, or when the child starts hitting people whenever he or she wants. That is a behavior that is warranted for treatment. And also when the behavior interferes with the child's ability to learn new skills, it is warranted for treatment. So if a child cannot sit still in a classroom to learn, or has difficulties paying attention or following instruction, it prevents the child from learning new skills. So it's a behavior that is warranted for treatment. And also, when the behavior limits the child's ability to access structured settings like school or church, especially church. You see, when we go to church, we sit for some period of time. So if the child has difficulty sitting wants to get up, is very hyperactive, that behavior is warranted for treatment. And also when the behavior increases the likelihood of intrusive interventions like restraint and medication. So when your child behaves in a way that you have to go to the extent of locking up the child in the room, that behavior is warranted for treatment, and the child needs to start any of the treatments I mentioned in the previous slide. Can be cognitive behavior therapy or ABA. Also, when the child's contact reinforces, when the behavior reduces the child's contact with reinforces or inhibits the child's social interaction. When you notice that your child has started playing alone, prefers to isolate him or herself, and the child is also not interested in any of the toys around him or her, that behavior is warranted for treatment. Okay, so here are some reasons why maladaptive behaviors occur in children on the autism spectrum disorder. Since most of the children on the spectrum have limited vocabulary or are nonverbal, they have difficulties communicating appropriately. Hence, they engage in the maladaptive behaviors as a way to communicate their needs or express how they feel. So and also when a child is not properly motivated to engage in an appropriate behavior, the child tends to put up maladaptive behaviors too. Therefore, most of the interventions for children on the spectrum are targeted towards their communication abilities, like trying to say a word or trying to point for something you want. That's most of the things that the therapies are targeted towards. Okay, so in applied behavior analysis, behaviors in children are categorized into 4 main functions. This means that every behavior has a reason. Every behavior that a child puts up has a function. And these include attention seeking. If a child tries to roll over the floor just to get somebody's attention, it can be mommy, daddy, anyone. It's attention, that the function of that rolling on the floor is attention seeking. Okay. And access to tangibles. Most children also throw tantrums when they want access to something and they can't communicate that I want this, I want that. And that tangible can be food, toy, to engage in an activity, or to go to a place. Okay, some children engage in maladaptive behaviors as a way to avoid or escape tasks. It can be house chores, homework. Most children throw tantrums just to avoid tracing or engaging in something with their parents or other children. And another function would be sensory, because most of the children on the spectrum have a lot of sensory issues. These some behaviors are related to sensory. They do certain things because it makes them feel good. It can be putting up their hands in their mouth for a while. It's making them feel good, but it is not an appropriate behavior that they should be putting up. Okay, so Edinam will continue from the procedure for behavior intervention. Thank you.
Thank you, Vera, for your presentation. So I'll take over from where Vera left off. We'll continue by looking at procedures for behavior intervention. And in ABA, we kind of try to understand what the behavior is. And we break it down using the ABC approach. So when we talk about ABC, we are talking about A being antecedent. And what that means is we want to know what happened before the behavior occurs. Oftentimes, people don't just behave without something happening. There's always a trigger to some sort. And so we try to understand what it is that happened before. And then we also look at what the behavior is. What does it look like? Is it biting? Is it throwing away a book? Is it running around and jumping all the time? So we look at that as well. And then we look at C, which is consequence, which looks at what the environment, how the environment responds to the behavior. So after a behavior occurs, there is a reaction or response from the environment that either encourages the behavior to keep on occurring or causes it to kind of reduce. So we'll move on to our first case example. And I have Kofi. Kofi is currently producing sound, but not words. So I'm going to break down a scenario, talk about the antecedent, behavior, and consequence. So we have Kofi. Kofi sees his brother holding a toy and wants it. And already we know that he's currently producing sounds, but no words. So he might not be in a position to actually say maybe toy. And so what he does, which is his behavior, is that he hits his brother and takes the toy. And I have two scenarios of consequences. So one, mom intervenes and comes to tell the brother, don't mind Kofi, and leaves the toy for Kofi. So that is the first scenario, which is a consequence or the response that happens in the environment after the behavior occurs. And then the second scenario is mom says no with a very calm but firm voice, and then models gently saying sorry to the brother, tells Kofi to use gentle hands next time, and then kind of tries to guide the children to share the toy, and also encourage Kofi to point next time when he needs a toy. So looking at this scenario, we knew there was an antecedent, an interest, or the child wanted access to a tangible object. And I want to focus more on the consequences. Mom, in the first option, in the option A, intervenes, all right. But then in this form of approach, what it teaches Kofi is that when I want a toy next time, I can hit my brother, and then mom would say, don't mind Kofi, and leave the toy for him. And so in such a situation, Kofi would continue to engage in the hitting, and that increases the hitting. And then for scenario B, mom gives him some tools on how he can kind of appropriately request for a tangible object. So we'll move on to our next case example. Okay, so Amma has difficulties with holding the pencil to write and is less interested in writing exercises. With the antecedents, teacher helps Amma to hold the pencil to write the first two words. So I'm thinking there are a lot of words to write, but after writing the first two words, our behavior started. Amma resists teacher support with holding the pencil and pushes the book off the table. So this is our behavior. She is using her gestures to communicate that she's not interested in what is happening. And so her pushing the book off the table is our behavior. And so let's see how the teacher reacts. In our A scenario, teacher shouts at Amma, picks up the book and sits with her to finish the work. And in the second one, teacher breaks tasks into smaller parts and gives Amma short breaks to stack Legos, peg and fix puzzles to build her fine motor skills and attention. So already we know that she has difficulties holding the pencil. And in order to encourage her to engage in that task that she really struggles with or finds very demanding, it's helpful if we give her the tools to be able to kind of improve on her fine motor skills. And then with the breaks, it helps her to kind of move away from that task that she doesn't enjoy. It doesn't mean that she wouldn't come back to it, but the task is broken down into maybe 2 or 3 or 4 parts. She will finish eventually, but she doesn't have to sit at a goal to finish all of them, like in the first scenario. And with the first scenario where the teacher sits with her to finish all the work, it might make her less interested in the activity in the future. And so it might continue to, the behavior of getting angry, throwing the book could probably continue and even become worse. So let's look at our third case example. So we have Sam. Sam is currently nonverbal and points sometimes. So in our antecedent, Sam is hungry and he bangs his head on the wall and cries. In the consequence, we have the first one. Nanny picks him up and offers him food because he has done that a few times previously. So this is something that has happened before. And then in our scenario B, Nanny takes notes of the time for the next meal and offers him food before he gets angry and bangs his head. So if you look at this, the first scenario or response from the nanny could actually continue to make the behavior occur, because if it has happened previously and nanny sees it and it happens again, and then you give the child the food, the child is learning that if I bang my head on the wall, I'll get that access to that food that I want, or I'll get your attention. And that will be the way the child will continue to communicate his hunger, instead of having instead of having the nanny in the B option, where she realizes that, okay, this child is nonverbal, but if I have a schedule, or if I have take note of the times that he often eats, I can present his food a bit earlier before the usual time that he would probably head bang, and that will reduce the head banging. Please, next slide. Okay, so as we've gone through what happens before the behavior occurs, when we are doing our intervention, we also tackle it the same way. We look at what we can change in the environment to reduce the occurrence of the behavior, and then, or to increase it depending on what kind of behavior it is. If it is a skill as acquisition behavior where the child needs to learn a skill like writing, then we are expecting that the child will be able to increase in doing that. If we're expecting the child to use words more, we are expecting that to increase. But if it is a behavior like tantrums, hitting, then we are expecting that to reduce. And then we look at replacement behaviors. We are looking at alternatives to replace the current behavior that is maladaptive. And so we use that as a teaching opportunity. We have to teach the child those replacement behaviors so that they can use them whenever that scenario arises. And as a key part of that in our work as behavior interventionists is teaching functional communication. So helping our kids to kind of improve on their expressive language, try to use, imitate sounds, imitate words, and then eventually build up on their communication skills. And then for the consequence, we are looking at how we respond right after the behavior, what we can do as parents, as teachers, as caregivers to reduce maladaptive behaviors. Please, next slide. Okay, so a key part of what we do, or one of the key strategies we use is to provide prompts for the clients. And these are kind of pushes that come before a behavior occurs. And they can be verbal directions, they can be demonstrations or model prompts, and they can also be visuals or physical guidance. So if you look at the picture I have on the left side of the screen, we have visual prompts. And this is a reminder to the child as he or she is completing a demanding task that you finish your work. When you finish your work, you get to play. So this visual is by the child as they are doing a task. Especially, it's helpful if it's something they have by them when they are completing every task, so that they get to understand it better over time, that whenever I am done with my work, I'll get to play. And immediately they are done, we hand over their preferred play item for them. Since that was what we are motivating them with, they are always looking forward to what they are going to play with. So they will do their best to finish their work and then move on to that. And then we also have the other picture where the child is asked to kind of point his nose, labeling of body parts. You see the gentleman pointing his nose. He's modeling that particular behavior or expected behavior to the child, and then the child does same. Some of our kids, because they are not able to kind of just pick up things as we talk to them, we have to demonstrate it to them so that they can learn or see what we are doing and try to imitate it as well. So I'll add some more examples to our verbal prompts. So like verbal prompts or verbal directions like trace A, sit down, stand up, fix the puzzle, hold the spoon. These are all verbal prompts, but not every child hears these simple instructions or prompts and then act on them. So we can add model prompts by modeling ourselves eating in front of a child. We'll hold the spoon and then show the child how we are eating and then see how they will try to imitate it. Also with words, we can say car, we can say sleep to teach a child. If they are sleepy, they can say sleepy. So we say these over time whenever the child is about to go to bed or whenever they are tired and they need a nap, so that the child will know that, okay, when I'm about to sleep, this is what I would say. And also with other gestures like communicative gestures like giving a high five or waving, those two would have to model it to some of our kids to help them to learn those skills over time. And then also we move to demand fading. So for demand fading, we are looking at reducing the amount of work the child has. And then we look at how we can make the child improve on kind of increasing the demand. So we reduce the amount of work. And then when the child is able to accomplish the specific amount of work we've given to them, then we increase it gradually. So when we look at our picture in exercise 1, the tracing exercise 1, for some of our kids, it's difficult for them to just sit down and do tracing exercise 2 at a sitting. So we would have to break it down for them. When they're able to do exercise 1, and we realize that they are doing very well with that, then we increase the demand. Yes, we increase the demand and challenge them further. And so when the child is able to do that, then you can probably try exercise 2 with them so that they can also continue to improve and then challenge themselves. Okay, so I also wanted to give some examples of additional examples of demand fading. For example, if the child is supposed to read in a class, a paragraph, we can give them the opportunity to read maybe 2 lines. Also, if you are teaching a child to maybe imitate apple after you, and they are able to say just up or ah, it's fine. And then continue to imitate the word to them, and gradually children are smart and are able to pick up over time. And then also, if it's a counting activity, the child can count maybe 1 to 10 since you know what they can do, the demand they can handle. And then whenever they master that, you increase that to maybe 20 or 15. Please, the next slide. So we also use task modification. This is a way of making the activity fun, interesting, and easier. It doesn't take away from what the child is going to learn. We are just making a few changes so that it seems more interesting to the child, especially with our kids who struggle with attention. If it's not interesting, if it's not colorful, if it doesn't catch the child's attention, it's sometimes difficult to get them to focus. So using like puzzles to teach them shapes, they can also kind of use their hands to draw the shape in the sand. It gives them the opportunity to have a feel of the sand as well, which is a multi-sensory opportunity for the child, because they are able to use their hands to touch the sand and then draw the triangle. We can also use music to teach different skills, washing hands. This is the way we wash our hands. This is the way we wash our hands. So you can make your own songs when it comes to the different things that you are teaching your child. And the usual nursery rhymes as well come in handy to help teach these skills. Please, next slide. And then also, choice is very helpful, giving the child 2 or more options to pick from. So in our examples, you have, do you want to use pencil, crayon, or chalk? Do you want to work alone or work with a partner? In all this, the adults, the parent, the teacher has the control to decide what the child picks from. So it gives you, the adults, the opportunity to limit the child to only what you want them to pick from. But then it gives the child options too, so that they don't feel like you are forcing them to only one option. So choice is very, very helpful. Do you want water or a snack? Do you want to work maths, read, or color? And it doesn't mean that these other tasks will not be worked on, but you do this first, and then the other options are presented. So you decide what you engage in the moment. It helps the child to learn from their mistakes. If they try out something and they realize this is not something that I want to do again, they learn from it. It also helps them to believe in themselves, know that they have some sense of responsibility. It helps them to also learn self-control, because if a child is given the option to, for instance, pick between a car, a bubble, and then a ball, and they want all at once, choice gives them the option to pick only one at a time. And so the child learns to control themselves until the other options are presented. And then it also helps with curiosity and creativity, because we don't view learning as a one-way thing. We create options and other means for the child to be able to explore and learn. Please, next slide. Also, another helpful strategy for our classrooms is providing an opportunity for other kids in the classroom to support a child who needs the extra help. So the buddy system or the peer support program, this helps to give the child the extra support they need in the classroom with completing their classwork or making friends or following instructions. That is very helpful for students who might be having attention issues. And for instance, a child tapping the classmates who needs that extra support, that look on the board. Maybe the child is fidgeting or looking somewhere else. Also, if the child is supposed to follow a certain instruction and they are not able to, that buddy would help the child to complete the task. And they also help with academic support as well. If that child is very good in a subject and the other child is struggling in it, they can be paired, and then the child who needs that extra support would have the opportunity to be supported in the classroom. So there are some points on the left side, on the right side, that talks about who a good buddy is. They treat their buddy the same as others. It kind of also helps to improve or build the inclusive school approach, so that if a child doesn't have a skill or have a certain special need, they still have a support in the classroom. And it helps other children to also learn about what this child is struggling in and how I can support them. It helps build empathy amongst the other kids as well. Please, the next slide. Okay, so after we've looked at what we can do to address the behavior, or to kind of manipulate the environment or make changes in the environment so that the behavior doesn't occur, we look at replacement behaviors. So we talked about some earlier, teaching the child what they need to learn so that maladaptive behavior doesn't occur. So replacement behaviors like playing appropriately with toys. So we work with kids who are, a lot of our kids are on the spectrum, and you see a child line up toys. So sometimes they don't know how to play appropriately with the toys, and it's helpful for you to teach them how to play with the toy. So if it's a puzzle, you can help them to fix it. If it is a car, you can push it and say vroom vroom, beep beep beep, and then the child sees you do it and then try. Give them the chance to also practice. So modeling that to them. If a child is always trying to put things in their mouth, they can have a chewy. And we work on this with occupational therapists who are specialized in handling like children with sensory processing issues or disorders. And these having a chewy can go a long way to help a child who just wants to pick anything to put in their mouth. Teaching a child who is maybe nonverbal and can use their gestures to raise their hand for help in the classroom. And then also teaching functional communication. So we've already mentioned that a key part of what we do is to help our clients to start improving on using their sounds, using their words. And so sometimes it's just about helping the child to request. If it's attention, they can request that they want a hug. They can say, play with me. If it is escape, or if the child is trying to avoid an activity, they can say, I want a break. Instead of hitting, instead of throwing a tantrum that will last for like 30 minutes and nothing will move on in the classroom. Like everybody is, like there will be no peace in the classroom because this child doesn't know how to request for a break or doesn't know how to request for help. Sometimes when when the child is doing something and they are struggling with it, they get frustrated. So teaching the word help can even go a long way to help reduce that frustration, and then help the child to better cope whenever they find themselves in a demanding task. Access to tangibles, the child can just go ahead to request what they want: water, juice, book, pencil. And then for our sensory, I have some examples for hyperactivity here. So for our kids who are hyperactive, it's helpful for them to have an opportunity to get the excess energy out. So giving them the opportunity to run around, engage in activities that requires them to move around, like jumping, stretching, once, like from time to time in the classroom, throwing ball and biking. These are all helpful ways of helping the child get out that excess energy. Please, next slide. Okay, so after we've taught the child their replacement behaviors, alternative behaviors, we are also looking at what other things we can do. Consequence-based intervention. After the behavior occurs, reinforcement is one of the ways we can help to either increase the behavior. So reinforcement basically refers to the consequence of the behavior. So it focuses on things that we'll do to either increase or reduce the maladaptive behavior. And there are types of it. We have positive reinforcement, which looks at introducing something or adding something in order to increase the behavior. So for example, if the child engages in an appropriate behavior, if the child is able to finish their writing assignment, you can praise them by saying, well done with writing your writing assignment or completing your writing assignments. Great job on fixing the puzzle. Great job on reading the book. So these are ways, and then our usual clapping in class to just acknowledge the child that they've done well. It goes a long way. Some children enjoy praise a lot, and it's something that helps them to be motivated and encourages them. So praise goes a long way. We should be praising our kids, no matter what's little or no matter how little it is that they have accomplished. Whatever it is, let's praise them. And then for negative reinforcement, we take away a consequence of engaging in a behavior. So this also seeks to increase the occurrence of the behavior. So for example, if a child has engaged in, has been able to complete their tasks, we can give them a break from work. We can also reward them by reducing their chores. So we are reducing something that the child might ordinarily have, would prefer that it would be less of. So most of the time, those are the things that we can reduce so that the child can know that, okay, if I'm able to sit down quietly and finish my work, then I would get the opportunity to maybe play alone. For some of our kids on the spectrum, they enjoy playing on their own. So that could be a way of motivating them. But they would also get opportunity to play with their peers as well. And then I'll talk about punishment, which is also a consequence-based intervention. Punishment focuses on adding or removing something to decrease the behavior. So we either add on yelling at the child, we reduce the playtime, we can take away the child's toy, or we can say that, okay, you would not be going to the playground today, taking away privileges. these are all punishments that can help kind of make the child realize that, okay, I need to stop this so that I don't lose these things that I like. And also I'll add that physical punishment should be the last resort. It's encouraged that we try these types of, all of these interventions I've talked about, they work. So if we have a child who have challenges, maladaptive behaviors, let's try these ones. And physical punishment should be the last resort. And I say this because physical punishment models aggression. And also, it doesn't teach any replacement behavior. If a child tantrums and you beat them up, they've not learned that, okay, if I wanted to have access to something and I can actually request for the thing, all they know is that I tantrumed and I was beaten. And so it doesn't teach the child an appropriate way or a replacement behavior. And then also, there are some kids, after beating them for a while or using physical punishment on them, they tend to see that as a way of getting attention from adults. And so, like yelling at the child, hey, what is that? Stop it. And all of that. Like it doesn't make the child it kind of gives the child more energy to engage in that behavior, because they probably think that it's when I engage in that behavior that mommy will come and talk to me, or my teacher will come and talk to me. So it's helpful that we create opportunities for the child to know that, okay, I can have access to mommy, I can have access to my teacher, and in a more positive way, I can go and ask mommy about something and not necessarily have to throw a tantrum because like just to get mommy's attention or daddy's attention. And then also it can also affect the children with their emotions negatively. It can also affect relationships and have implications for mental health as well. So that's what I'll say about the punishment. Please, let's move to the next slide. Okay, so other strategies we can use to help address or help our kids with maladaptive behaviors is to teach emotional regulation and coping skills. So the zones of self-regulation is a fun way of teaching children to identify their emotions. And it breaks down the emotions into 4 parts. Blue parts, which focuses on when the child is down, they are sad, they are tired, and it encourages that the child gets some rest. So you go to the rest area when you are in the blue zone. When you are in the green zone, you are good to go because you are calm, you are ready to do your work, and you are in a good place to play with your friends. With the yellow zone, the child can be excited or scared. There is some level of emotional how do I even say it? Some increase in excitement or high level of emotion to some extent. And so the child needs to calm down. And there are options down there that the child can pick from, things that the child can do, whether they will take in deep breaths and or go and read a book. These are all things that a child can do whenever they are feeling any of these emotions, so that they can get back into the green zone. Please, the next slide. Also, it's helpful for us as adults to promote healthy behavior patterns. So we should lead by example. We need to be an example to the kids. If it's specific behaviors that we want the child to engage in, we should try to engage in them as well. And then encourage physical activity, encourage healthy eating habits as well. And then also, we have to have clear expectations and boundaries. And also, if we have to have a routine that we stick to. And in case of a change in the routine, it's helpful for us to prep the child before that change occurs, so that the child would have enough time to prepare themselves for the change in their routine. And also, I would add that I would encourage our parents and our teachers to be very firm. Oftentimes, children can be very manipulative. If they realize that today you said this and tomorrow you are relaxed or you are not really firm on it, they tend to play with that. And so it's helpful for us to have these clear expectations and be firm and stick to them. Also, we have to be patient, even in our bid to kind of correct a child who is frustrated, who is throwing themselves on the floor and screaming. We have to model calmness. We have to be calm so that they kind of see that over time they will get to also pick that up from us. And then also give room for them to kind of learn from their mistakes as well, problem solve, give them alternatives. So if a child is probably trying to do an activity and they are struggling to do it, you can help them by giving them an alternative or giving them examples of how they can do that particular task. So for example, if a child is trying to fix a puzzle and they are not able to turn the puzzle into the spot it goes into, and you can sense that the child is getting frustrated, you can help them to turn the piece and fix it appropriately. And then we have to foster a supportive, nurturing environment. We should affirm our kids and also continue to convey love and respect and listen to them as well. Please, the next slide. And then also, it's helpful for us to gradually expose our kids to situations or tasks or activities that they might not enjoy. The fact that a child doesn't enjoy something or seems less interested in it doesn't mean that they get away with engaging in that activity. So we would gradually introduce it, just as I talked about in the demand feeding, and then help them to gradually build tolerance for it. Role playing, more practice, more opportunity would help build those skills. And with our kids who are older and can kind of process some of the things or even write, they can journal the ABC. They can write, okay, so what happened before this behavior occurred? And how did I act? And what was the response I got? How can I make it better next time? And also, we help challenge negative thinking. Sometimes our kids feel they can't do things. Sometimes we have to encourage them and give them the support to kind of remind them that they are able to, they can do it. Encourage them, refer them to what they had done before. Maybe you were able to read this last time, you can do it again. So using that positive voice, being that positive voice for the child. And also giving them the opportunity to play and socialize. For our clients who are on the spectrum, they benefit a lot from this, and every child benefits from this. As they play with others, they learn from them social skills. They get to learn to imitate certain expected behaviors and skills. And so it's very helpful for them to get to opportunities to play with others. So thank you very much for your time, and it was great having you all here.
Hello. Thank you all too. Thank you, Madam Edinam and Madam Vera, for such a lovely presentation. So, Mission Pediatrics has wonderful therapists like behavioral therapists like Madam Edinam and then Madam Vera. So if you have a ward or anyone you know with a maladaptive behavior or any neurological condition, you can find our clinic. That's Mission Clinic at Caprice. And please, now it's time for questions. So if you have any question, please raise your hand so that you can unmute yourself and talk, or drop your questions in the chat box. Thank you.
So I'm just seeing a comment from Miss Elizabeth. Oh, I actually didn't see this earlier. I hope you followed all that we said, and I apologize because I really didn't see the message coming. And yes, Madam Mercy, you can have access to the slides and notes after we are done.
Okay, so please, there's a comment in the box, and it's from Miss Elizabeth. And it says, thank you both, Miss Edinam and Miss Vera. That's insightful and educating.
Thank you to Madam Elizabeth.
Okay, so I'm just waiting for about 1 minute, and if there's no question, we'd have to bring this meeting to a close. Okay, so once again, we thank our panelists so much for their amazing presentation, and we thank you so much, Dr. Mabel, the CEO. And then we thank each and every person that took part in this meeting. We do not take your presence for granted. Thank you all so much.
Fiona, I'm seeing a comment from Dorinama Glory. She said, thank you so much. Great presentations. Sometimes it looks like those who are soft are taken for granted. Or is it a wrong observation? So those who are soft in terms of the adults, I don't really get your question. If you could clarify that. In terms of discipline, yes, so soft, so by the kids, taken for granted by the kids, do you mean by the kids? Oh, okay, yes, please. So there should be a balance. As it's more like tough love. You have to show the child that this is this particular thing is not expected, but then I'm still going to be that supportive parent. So yes, they are very smart and they can manipulate us. So we have to be very, very aware of that. Thank you for your comment, Madam Doreen.
Okay. So, so from Madam Doreen, yes, please, thank you so much. Okay. So, if there's no more questions, there's no hand up, that means everyone is clear and everyone had a great time. So I'd like to say thank you all so much once again for your time and then for your participation. We do not take your presence for granted. So kindly make a date with us next month, the third Saturday, and we'll have another parents roundtable discussion. So at this juncture, I'll bring this meeting to a close, and bye. Enjoy the rest of your weekend. Thank you all.
Bye. Thank you, Fiona. Bye,
Thank you
everyone.
to Madam Edina. Bye.